Rotator cuff injuries can cause a variety of symptoms that make everyday tasks difficult. Things like reaching overhead, lifting household items, or sleeping comfortably at night. The symptoms can vary depending on which of the 4 rotator cuff muscles is involved. So let's break down how each one of these commonly presents. First is the supraspinatus. This is the most commonly injured rotator cuff muscle. Patients typically describe a deep ache on the outside of the shoulder, right around that mid-deltoid region. In some cases, the pain can even travel down the outside of the arm towards the outer elbow, and occasionally up into even the trap area. Clinically, this muscle is the most painful during shoulder abduction, or lifting the arm out to the side, especially in what we call the painful arc, between about 60 and 120 degrees. A lot of patients also notice pain when reaching across their body. One thing I hear all the time is, I can feel the pain, but I can't massage it out myself. It feels deep in there. And that makes sense because the supraspinatus sits underneath the deltoid muscle, so it's difficult to access directly unless you know exactly where and how to treat it, which we'll discuss later. Second is the infraspinatus. This is the second most commonly injured rotator cuff muscle. This muscle commonly creates a strong, deep ache in the front of the shoulder and deep within the joint itself. The pain can also travel down the front and outside of the arm, and in some cases even reach the thumb side of the hand and fingers. Some patients also feel referral around the shoulder blade area. Clinically, this is often the muscle behind complaints like, I can't reach behind my back, or I can't sleep on this side anymore. Third is the teres minor. Teres minor pain is usually very localized. Patients often point to a very small area about the size of a silver dollar on the back or side of the shoulder. Unlike some of the other rotator cuff muscles, this pain usually does not travel far down the arm. Occasionally, patients describe a sense of fullness or tightness in the back of the shoulder. Because the pain is so pinpointed, it's commonly mistaken for a simple shoulder strain or even a bursa irritation. Fourth is the subscapularis. The subscapularis often causes severe pain in the back of the shoulder joint and around the shoulder blade. One unique feature of this muscle is that it can create a strange strap-like pain around the wrist, almost like the patient is wearing a tight, painful watch. Because this muscle sits underneath the shoulder blade, it's commonly overlooked. If someone has unexplained wrist pain along with shoulder stiffness, the subscapularis is often involved. Patients may also notice tenderness deep in the armpit region because that's where the subscapularis muscle lies. Next, we'll discuss goals and expectations with the rotator cuff program so you know which progress should look like.